A somber anniversary as Michigan marks 6 years of coronavirus. It was Tuesday, March 10th, 2020, when the first 2 cases in Michigan were confirmed.
Yes, and the situation has evolved quite a bit since then. While COVID-19 is no longer at the front of everyone's minds, it still poses a risk with other respiratory viruses.
Joining us to talk about the state of Michigan health is Chief Medical Executive Dr. Natasha Bagdasarian. Always good to see you. Thanks so much. Let me start with where we are. How much of a threat is coronavirus right now? And I guess the subtext to that is, does that have anything to do with the way folks view the vaccine these days?
You know, COVID-19 is still around. I think a lot of folks aren't really thinking about it all the time, but it's still here. It's still one of our viral respiratory pathogens that folks are dealing with, and it's still putting people in the hospital. But it's sort of joined a crew of other viruses that are all causing issues over the winter months. So it's now working, with things like influenza and RSV to wreak havoc on hospitals and healthcare systems during the holiday months. What we saw this past year is we saw most of our hospitalizations and most of our illness coming from influenza. It was not a big year for COVID. Now we're starting to see RSV ticking up, but all of those 3 things coming together can really overload our health systems.
Absolutely. And what about the flu and the number of Michiganders getting vaccinated? Has that number been down, and do you see that being an impact and why flu has been so high this season?
It's definitely a factor. So, of course, we have a flu vaccine every year. We also have a COVID vaccine every year. And the number of people getting those vaccines has been dropping every year since 2020. So it's concerning. And I think that's why we're seeing so many people ending up with severe illness and ending up in the hospital.
How do you change those trends? Obviously, you're mentioning fewer vaccinations. We've seen what's happening at the federal level with the new Secretary of Health and just his views on vaccines changing when it comes to some of these illnesses.
Well, what I would advise people is listen to your healthcare provider, listen to your doctor, listen to the people who take care of your health. My background is I'm an infectious disease doctor, and I have watched people, young, healthy people, die of influenza and die of COVID. So I know how truly bad it can be. And I advise my patients accordingly. And I really want folks to listen to their healthcare providers who understand the risks and who really understand the data.
And let's stay there with some of the federal landscape as it relates to controversies surrounding Tylenol and autism and new dietary guidelines that are coming out of the federal government. What's your take on that, and how concerning is it?
Well, I think at the end of the day, we all want the same thing. So whatever your political views are, no matter what your beliefs are, we all want our families to be healthy. We all want the people that we love to be as healthy as possible. Now, it's how we go about doing that I think there are some different approaches out there right now. And what I really recommend is for folks to, again, follow the science, follow the data, and listen to their healthcare provider on all of these issues. So if you listen to the medical organizations, they've come out very strongly and said that Tylenol, when used appropriately, is safe during pregnancy, for example. This is a safe medication. We know that vaccines have an excellent safety profile and that they can in fact save lives. So I'm really urging people that we all want the same thing at the end of the day. And let's just follow the science and take a balanced approach to how we go about making our communities healthier.
Do you expect any of the outbreaks we've seen nationwide, and I know there's been some in Michigan when it comes to measles, do you expect those to get worse?
Yes, I do. So far, it's only March. We've had over 1,200 cases of measles across the U.S. That's a lot. Last year, we had just over 2,000 cases for the whole year, and last year was a terrible year for measles. So we expect to see this get worse. There's a huge outbreak in South Carolina. There's an outbreak in Florida, an outbreak in Utah. We know folks are going to be traveling over spring break. And so there's a good chance that folks will bring some of these diseases back home to Michigan.
What is your message then, Dr. Bagdasarian, in terms of getting those vaccinations for children?
we've got the tools. These are diseases that we know how to combat. We know how to make sure families don't get measles. The vaccine is 97% effective if you get 2 doses of the MMR vaccine. So this is a really good time to make sure you're up to date with all your vaccinations. And again, talk to your healthcare provider.
And that was a disease that was eradicated completely in 2000, correct?
It was eliminated in 2000, and we risk losing that elimination status. Last year in Michigan alone, we had 30 cases of measles, and I'm anticipating that we will see either the same or potentially worse this year.
Dr. Bagdasarian, as always, we appreciate you joining us this morning.
Thanks for having me on.
Absolutely. Always good to get her perspective.